Thanks for joining us here on this special edition of Focus on Africa from BBC World News. I am Peter Okwoche. As the number of confirmed coronavirus cases in the world exceeds 1 million people, the founder of Microsoft and co-chair of the Gates Foundation, Bill Gates, says the window for making important decisions that can contain its spread hasn't closed. Back in 2015, Mr. Gates warned that the world was not prepared enough for a pandemic. At the time, his intention was to stir up countries to look at their health sectors and science. Little did he know then that his prediction could happen this soon. Mr. Gates has worked closely with developing countries on health issues for a long time, and he joins me now from Seattle in the US. Thanks for joining us, Mr. Gates. How devastating has this pandemic been for the world so far?
Well, it's really a stunning, gigantic problem. The medical challenge, the deaths, the economic impact, it's very unprecedented. And so as soon as we can get the right tools to bring this thing to an end, that's going to be of gigantic importance.
I mentioned your speech in 2015 at a TED Talks when you said you didn't believe that the world was quite ready. At that time, did you envisage anything of this magnitude?
Yeah, the example I gave in the TED Talk was a flu spreading and killing 30 million people and causing about $4 trillion of economic damage. And sadly, what's happened here mirrors that pretty closely. And a lot of the things we could have done, like having diagnostics that could be deployed quickly, having the drugs, having built a vaccine platform to shorten the time for that to get out, most of those things did not happen. Now, there was some work. CEPI is a group that our foundation, Wellcome Trust, a number of governments did fund to start to do some of this preliminary vaccine platform work. But we do find ourselves unprepared, scrambling, and it's a tragedy. The sooner we can get the testing right, get drugs to reduce the severity of the disease, and a vaccine, the sooner we can bring it to an end.
Why do you think the world has been so slow off the mark when it comes to preparing for a virus of this magnitude?
Well, it's hard to be ready for something novel. The way we do it in terms of war is we have full-time soldiers. They do war games. They come up with different scenarios. They try things out. They see problems. They keep refining it. There is no group of people who are there for this epidemic who thought through, okay, how quickly do you approve PCR testing? How do you make billions of doses of a vaccine? And so there just wasn't the staffing or funding, almost as though people thought it couldn't happen. And yet, it actually, in my view, in 2015, it was the biggest risk of something very, very negative happening. I wrote a New England Journal of Medicine article that went into more depth about the particular things that needed to be invested in.
Now, do you think the window to contain this virus has closed? Are we so far behind that it'll be very difficult, rather, to contain it?
No, we can contain it. China is an example of a country that by late January acted in a very decisive way. And now, although you wouldn't say they're back to normal, they do have workers going into the factories. Their schools are reopening. And so they're in a better shape than the countries that are having to really curb those activities for a couple months in order to reduce the infection rate and get the number of cases first to plateau and eventually go down, so then they have a chance to open back up.
That's a point I wanted to pick up with you, because in a recent op-ed that you wrote for the Washington Post, you advocate a total shutdown in countries as a way of containing this virus. And I'm looking at the instance of poor nations in the developing world where you've got all these shanty towns, people living very close together. I mean, how feasible is self-isolation and social distancing in these areas? I mean, can a shutdown work there? I mean, it doesn't sound as if it's a one-size-fits-all.
Yeah, the Gates Foundation, of course, does most of its work helping the developing countries with their health needs. And the policies that worked in China and should work in rich countries will not work as well in poor countries. And in fact, the disruption of food supplies and getting access to normal medicines could be more difficult in the developing countries. So exactly what the distance policies should be and how they'd work, it's another thing that we didn't study enough. And I am very worried about what you're saying is that the spread will not get stopped in the same way. And so, it just reminds me that the work we're doing to get a vaccine for the entire world, which the countries aren't really focused on that, but our foundation goes in saying we need 7 billion doses of this vaccine. So social distancing in developing countries, exactly what those policies should be to minimize the damage that those cause. We need some very smart people. We need some modeling. It's not as you say, one size fits all, where this is going to work in an urban slum in Africa.
And I just wonder what you make of the various ways that countries around the world are trying to curb the spread of this virus. I mean, if you look at Sweden, where they're looking at some sort of a herd mentality. Can you hear me, Mr. Gates?
Yeah, redo that question.
Okay, yes, I was just asking if what your take is on how some of these countries are trying to curb or contain this virus. In Sweden, they've opted for somewhat of a herd mentality. In China and South Korea, it's testing. Here in the UK, the people that they're testing are those who are already in hospital and those at the front line fighting this virus. What do you make of all those different ways of fighting this virus?
Well, every country needs to up its testing capacity. That's how you know where the spread is to set the right policies. And the initial grants our foundation gave in Africa were about getting that testing capacity increased. The UK understands they need more testing capacity. They're moving to do that. I believe that all the rich countries need to do the dramatic social distancing, and it'll just be a question of those who do it late will be sorry that they do it late because they'll see a bigger epidemic because of that. So I think most of the rich countries are falling into line on that. South Korea was an exemplar in that they really got the testing going very, very quickly. Taiwan was an exemplar that they realized this problem before anyone else did, and they managed to control people coming with the disease enough that they haven't had to do this shutdown, and yet they haven't seen a huge number of cases. So the earlier you act, the better. What those policies should be for developing countries, aren't as clear as it is for the rich countries.
The virus spread to Africa much later than it did to other parts of the world, and some commentators have said this should have given Africans and their governments enough time to prepare for the virus. Do you think African countries took that opportunity on and prepared for it?
Well, the health systems are not as strong in Africa. And so that's why I think all of us are so worried as those numbers go up. What's this going to look like? I had a good talk with President Ramaphosa this week. He, as head of the African Union, is making sure this is getting the right attention. There's WHO Africa, there's Africa CDC, both of which we've been funding. So it's good news that we're starting with what appears to be not a huge number of cases. we're not sure how much weather and seasonality affects the transmission of this virus. We have to assume the worst case, which is it transmits in Africa as effectively as it does in northern Italy or New York City, where we're seeing these big spreads. We might get lucky on that, and the hot weather or outdoor reduces that, but it would be unwise to assume it. If it is seasonal, then of course the southern hemisphere is starting to go into the period where respiratory viruses are the most active. So that could kick the number of cases up. But the testing funding we did is to really not be blind to know, what do those numbers mean? Does it just mean that the testing hasn't been done?
And do you have any predictions of what you think a post-COVID-19 world might look like once this virus has been contained? I mean, we know that the human race is not one that actually learns a lot of lessons from things like this. I mean, what do you think the world might look like post this virus?
Yeah, so the key thing is to get a vaccine and get that out to everyone on the planet. And I do believe, and we talk about 18 months or so is, the current guess. We could do better than that, or it could take longer. I'm sure that given how awful this has been, this time the world will pay attention and have standby capacity so that the next time it comes, the response, the diagnostics, the drugs, the vaccine will all be dramatically better, which the quicker you are when something spreads exponentially, it's a night and day difference. So even though the outbreaks like Zika, Ebola, SARS, MERS did not cause the right investments to be made, now I feel confident that they will be in the state of the biology, things like an RDT, a rapid test for these things, the ability to have standby manufacturing that you only have to change a little bit for a particular pathogen. The world this time will do what's required.
And Mr. Gates, given how much time and resources you've devoted to public health, I just want to ask you a personal question about how you feel when you see the devastation this is having on your neck of the woods, so in Washington, in New York, in the U.S. in general.
Well, it's, when I talk to the governor of New York and he's trying to get a projection for the ventilators and doing the best he can, when I hear about the relatives of the people at the foundation, who work at the NHS and they've seen the medical workers get infected left and right. This is a unbelievable tragedy. The medical pain, the economic pain, the psychological pain that almost everybody in the world is going to go through. It's a sad thing. We need now to get organized. Our entire foundation, all of our health expertise is shifting to do this work. It will mean things like polio. Sadly, that work will be interrupted, and so that will spread back somewhat. Our malaria work will be somewhat interrupted. So, everyone's having to make extremely difficult trade-offs here so that we get to the point where, we can go back and not worry about this. But, it's going to be quite some time before that ultimate solution, the widespread use of the vaccine, is fully delivered.
Mr. Gates, it's great to have you on Focus on Africa. Thank you for your time and for your insight into this pandemic. Thank you very much.
Thank you.
Well, you're watching Focus on Africa from BBC World News. Still to come, the latest on how the coronavirus is impacting Africa and the rest of the world. Welcome back to Focus on Africa. New York has suffered its deadliest single day from the coronavirus, with 562 additional deaths. The total number of deaths across the state is now 2,935 fatalities. In the last hour, Governor Andrew Cuomo warned that the people will continue to die due to a lack of ventilators, and he called for other states to help New York deal with the growing crisis.
New York is in crisis. Help New York. And then pick up, decamp, and then go to the next place as this rolls across the country.
In Europe, Spain has overtaken Italy in its total number of confirmed coronavirus cases, meaning it is now fighting the second biggest outbreak in the world. The latest figures show Spain now has nearly 118,000 infections. All this comes as the number of people around the world infected with COVID-19 passes 1 million. That's according to a tally of confirmed cases being recorded by the Johns Hopkins University in the US. The true figure, though, is likely to be much higher. Let's show you what those figures look like. This graph shows infections from the start of March. China is way ahead, but watch Italy, which leaps to second place by the middle of March. Spain overtakes Iran to go third, but it's the rate of infections in the US which sees a dramatic increase by the end of the month. Well, there are now more than 7,100 confirmed cases of coronavirus across Africa and almost 300 deaths. But more than 650 people have also recovered in Nigeria. Cases are rising towards 200, and authorities say they are testing 1,500 people every day. Close by in Ghana, cases have climbed to more than 200. Let's get more on that now from the BBC's Thomas Nadi, who is in Accra for us. Thomas, Ghana was one of the first countries to take steps to limit the spread of the virus within its borders. Is there a surprise there that it now has one of the highest numbers in West Africa?
Well, Peter, it has come as a surprise to many. But the majority of the cases are from travelers who've been quarantined. The government has also increased community surveillance in the form of contact tracing and then testing of all individuals who might have come into contact with COVID-19 patients or exposed to the virus, especially in cities that have been put on lockdown. Now, the objective is to ensure that they identify and isolate infected persons from the rest of the communities so that they can prevent or slow the rate of contagion. And about 6,000 samples have been taken from individuals for testing so far.
And Senegal is also struggling with high numbers of those that have tested positive. What's been the government's reaction there?
Well, the government in Senegal has taken a number of measures, just like other parts of the world. The government has declared a national state of emergency. Public schools have been suspended, public gatherings have been banned, and the international flights have also been banned. But what they've also been doing is to intensify contact tracing and testing of all suspected cases so that they can isolate them from the rest of the community.
And what measures are being taken then regionally in West Africa there to test people for the virus? Because we hear the WHO say testing, testing, testing.
Yes, testing is very important. Now, what is happening is that a number of countries receive test kits from Chinese billionaire Jack Ma, and that has helped in improving their ability to test more suspected cases. And as you mentioned earlier, Nigeria, for instance, is now testing 1,500 samples a day. Togo has also now intensified testing and deployed mobile vans across the country after imposing a dusk to dawn curfew on Thursday. So what it basically means is that more countries are now beginning to test and then to prevent the virus from spreading within communities. What it also means is that in the coming days, we are likely to see an increase in the number of COVID-19 recorded cases in this part of the world because more people are getting tested, Peter.
Okay, Thomas Nadi there live from Accra. Thank you very much. To Zimbabwe now, as they approach the end of their first week of lockdown in response to the coronavirus outbreak. While the disease has claimed thousands of lives around the world, Zimbabweans are concerned that the restrictions on movement will limit access to food. That's in a country where they're already struggling to feed their citizens. The BBC's Shingai Nyoka sent this update from the capital, Harare.
Zimbabwe is seeking just over $2 billion in aid during very challenging times in the global economy. It says that it needs some of that to fight COVID-19. The country is already confronting the effects of drought and economic collapse. Widespread famine has left about 7.7 million people. That's just under half of the country's population in need of food aid. And the government says that a tenth of the aid that it is seeking for will be used to create isolation centers, to acquire test kits, as well as ventilators, to improve sanitation and increase food aid. And that the number of people that need food assistance has increased as a result of the lockdown. On Monday, the country began a 21-day lockdown, and for the most part, people have stayed at home. But police say that they've arrested just close to 500 people for violating regulations, including public drinking in informal bars and breaking the rules of social distancing. Shingai Nyoka, BBC News, Harare.
And let's bring you a recap of our top story as the cases of coronavirus passed the 1 million mark. Bill Gates, the founder of Microsoft and co-chair of the Gates Foundation, has told Focus on Africa that there is still a window to get ahead of the coronavirus. I spoke to him earlier on the program.
When I talked to the governor of New York, and he's trying to get a projection for the ventilators and doing the best he can, when I hear about the relatives of the people at the foundation, who work at the NHS, and they've seen the medical workers get infected left and right. This is a unbelievable tragedy. The medical pain, the economic pain, the psychological pain that almost everybody in the world is going to go through. It's a sad thing. We need now to get organized. Our entire foundation, all of our health expertise is shifting to do this work. It will mean things like polio. Sadly, that work will be interrupted, and so that will spread back somewhat. Our malaria work will be somewhat interrupted. So, everyone's having to make extremely difficult trade-offs here so that we get to the point where we can go back and not worry about this. But it's going to be quite some time before that ultimate solution, the widespread use of the vaccine, is fully delivered.
As the founder of Microsoft and co-chair of the Gates Foundation, Bill Gates speaking to me earlier on the program. Now, the American singer-songwriter Bill Withers, whose hits included Lean on Me and Lovely Day, has died. He was 81.
Wonder this time where she's gone.
Born into a coal mining community, he became a Navy mechanic and then worked as an aircraft assembler before becoming a star in 1971 at the age of 32 with Ain't No Sunshine. He followed it with a string of hits in the 1970s, all based around his distinctive soulful voice. In a sign of the popularity of his music, Lean on Me was performed at the inaugurations of both Presidents Barack Obama and Bill Clinton. Bill Withers, who's just died at the age of 81. Now, don't forget, you can get in touch with me and some of the team on social media. I'm at Okwoche. But that's it from Focus on Africa with me, Peter Okwoche. Thanks for watching.